Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Well, when I get up out of bed, it's a 10.
10.
Yeah, it just feels like my whole, everything's gonna rip out.
Okay. So we'll have you do the turning and get out of the bed.
Well, this is usually what I have to do. I usually get up on this side, so it's a little different. Oh my God. Really, literally.
So you're using your elbow so you don't use your abdominal muscles. So you see, she's using her elbow to lower her body, you know, and then we're gonna have you turn and so look at her elbow. Look at this. So she's not trying to use her core muscle. She's using her elbow and her hand. How much pain from 0 to 10?
Actually, it's not real bad right now. I don't know why, but it's not.
People feel better when they see me.
Yeah, that's probably why. It usually is how it is, but it's about a 7.
7.
So I just try to
We'll do the same
get up
way.
normal.
The same way.
I'd rather just try to get it normal. That's a first right there.
Okay, how's that?
I haven't been able to do that in a long time. Yay!
Okay,
But it's still caught
where it's caught.
right here.
Scar tissue, I did a lot of release. That's release a
my
lot of
hip
toxins.
is the good one. It doesn't burn.
It doesn't burn?
There's like a 0 on the hip right now.
Let's drink some water.
Let me get it so it does whatever it does when I first
Okay.
go down.
Alright.
Okay. Well, right there is a big difference.
You're moving faster. Did you notice before she was like on her elbow and her
Yeah,
wrist?
I've never been able to sit up like that
For how long?
since January.
Okay.
Yeah.
So she's trying it again. That's good.
Excited.
Yeah, I'm excited too. Yeah. Look at that. That's beautiful. Yeah.
Okay.
Oh, you doing crunches now? Are you trying to show off now? Look at that. That's
Oh
beautiful.
my gosh.
Yeah.
Thank you so
Yeah. Yeah. I'm glad about the treatment. You had PT before.
You know,
You had massage.
I've
so-
had everything before and I've never been able to sit up. Even
Yeah.
after a massage,
Yeah.
it takes me a long time to get up off
Yeah,
the
it does not
table.
break the scar tissue. Yeah. Yeah.
Thank you.
Yeah. Awesome.
Tears
Yeah.
Yeah, I
Yeah.
know. That was
Yeah.
amazing. Right
Awesome.
there.
I'm glad you're feeling better.
Thank you
Yeah, well,
so much.
glad it's
Okay.
working. Awesome. Thank you. How many years that was going on?
The sciatic was going on for quite a while. I
Okay.
would say maybe 5 to 7 years.
What kind of treatment you had during those
I've had
5 to 7?
Physical therapy.
Okay.
I've done, I had a ablation done for
Okay.
a nerve where they killed the
Wow.
nerve.
Uh-huh.
I've had a few shots of the
what-
epidural shots.
Epidural shots,
Yeah, the
okay.
cortisone type
Mhm.
shots.
Mm-hmm.
Just lots of physical therapy.
Oh, a lot of
Nothing
physical
has
therapy.
helped.
Okay.
Nothing. And like the last physical therapist that I went to even said, just don't lay down.
So let's actually have you lie down and
Okay.
get up, and we're just gonna see after a month of like actually total 4 treatments, but this is a month follow up. You're fast.
And before, when I did this, I could feel everything in there kind of shifting around.
Yeah. Uh-huh.
And I was like, oh no, I don't want to get up. And I could not do
Wow, that's so fast compared to the first time.
that. I could
That's
not
beautiful.
Get up at all. I'd have to pull
That's
myself
beautiful.
And
What do you think about ASTR treatment?
up. I think it's well worth it. Anybody should if they're having problems, come get it done.
Yeah,
Yes, give it a try because it's well worth it.
Yeah, thank you so much. I appreciate
welcome. No,
that.
thank you.
Thank you. Part of the video, I will show you how you can treat your back pain at home and get similar result to the result actually you saw in the video before. First, you need to have the Patient Toolkit. These are the same tools I use it on the patient. It's 4 tools that you can use it at home on the entire body actually. If you have moderate to severe inflammation, I recommend you get the MagnaHeal 2. It's a wearable, adjustable belt that can be used throughout the body, including your back. Of course, you need the back, step-by-step back program. It's about an hour and a half that I cover everything I usually go over with my patient when they come and see me in the clinic. Lastly, if you have moderate to severe inflammation, I recommend you get the inflammation supplement kit. So first, the Patient Toolkit. It comes with 4 tools. A3, we use it to break down scar tissue. A1, we use it to release superficial fascia restrictions. A5, we use it to release deep fascia restrictions and also to break down deep scar tissue. And lastly, MagnaHeal 1, we use it to decrease inflammation. So one of the common question is, can I get one tool and treat myself? Yes, you can, but you're not going to get similar result to the result you see it in the video because each tool treats a specific issue. So the scar tissue release tool does not release fascia restrictions, and the fascia tool does not decrease inflammation. So each tool has its own function, and really to get the control of the problem or get rid of the pain, you really need to treat the whole problem, not just part of it. So for moderate to severe inflammation, patient has arthritis, stenosis, herniated disc, I recommend you get the MagnaHeal 2. It's a wearable adjustable belt. It's penetrates around 3 inches deep, so you can use it throughout the day. It comes with 3 belts, decrease inflammation and relieve pain. So the step-by-step program, you actually can do the program on the abdominal area and the hip flexors in the front of your thigh. For the back part, you might need help with the partner to work on the back. The treatment typically takes 5 minutes per day, so it's very easy to follow the video actually for the treatment, and with some help you're probably going to be able to work on the back. So the step-by-step program, I cover how to use the tools, how to relieve your pain at home, the exercises you need to do after the treatment. We'll go over proper posture, body mechanics, gait, behavior modifications, anti-inflammatory diet. It's basically everything that you will go over with me in the clinic to see me. The only difference is that you're the one going to do the work, or you might have some partner to help you in the back area. For moderate to severe inflammation, I recommend you get the inflammation supplement kit. These are formula that work very well to decrease inflammation. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.